Simon sent in a question asking your opinion on the link between diabetes and penile pain. In his opinion, he says it's largely ignored.
Yeah, so I think what the patients with diabetes are at risk or have a high risk of erectile dysfunction. So that's one of the big risk factors for erectile dysfunction. They also have a high risk of neuropathy. So what those patients can get is they can get a combination of erectile dysfunction and lack of penile sensitivity. And they can also get penile pain. But I think because some of those patients have lots of comorbidities, I would agree with Simon that the penile sensation, penile pain, erectile dysfunction is kind of lost.
Is there any hope for those patients if they've got an underlying comorbidity like diabetes? Is there something that can be done for them to help?
Yeah, so that's starting to get into the into that kind of area of erectile dysfunction. So I think probably the most important thing we need to be aware of with erectile dysfunction is that it can, a bit like Simon has raised, it can be indicative of something else going on. So if someone presents with onset of erectile dysfunction, that can indicate heart cardiovascular disease, because those penile arteries are kind of small circumference. They tend to be some of the first arteries that are affected by heart disease. And my good friend, Dr. Jo Milius, who's an amazing men's health physio in Perth in Australia, she's got a great phrase that heart health equals heart health. So it's picking up while this patient is reporting erectile dysfunction, you know, have they been screened for cardiovascular disease, diabetes? Then to answer your question, what those men, you look at those men in terms of lifestyle, and that's the difficult one. So it is relatively straightforward to prescribe those men via their GP low dose daily Cialis or Tadalafil. So that's one of the erection modifying drugs. So those men should be on low dose Cialis or Tadalafil. It's about 5 milligrams per day. Some of them will benefit from using a vacuum pump. So the vacuum pump is a kind of a device that helps create erections. You try and use it maybe 4 or 5 times a week, and it almost replaces those housekeeping nocturnal erections, morning erections.
Right. I'm so glad you didn't bring one in to demonstrate.
So is Jack, who's sitting to the left, who was almost heading out the door. In terms of erectile dysfunction, the medication is relatively easy to take. Vacuum pumps, some of the older men get on better with them.
Right.
The difficult thing is looking at lifestyle, smoking, alcohol. BMI, visceral fat, abdominal fat, exercise, levels of stress. And those are the things that people sometimes find it difficult to engage with.